Okay, so let's talk a little bit about blood vessel anatomy. So there are 5 types of blood vessels in the body, and there's going to be basically 2 types of arteries, 2 types of veins, and then capillaries. So all vessels contain certain specific layers, okay? And there's 3 layers of tissue, okay? So the inner layer is called the tunica intima. The middle layer is a tunica media. And the outer layer is the tunica externa. So within those layers are certain tissue types. So we've got, or there is, a fibrous tissue type. There is a smooth muscle tissue in there. There is elastic tissue. And there is endothelium. So not all of the vessels have all of these things. Some do. So if we look at, first we look at a capillary. So a capillary is the smallest vessel. It is where exchange, gas exchange, and things like that occur. And in order for that to happen, the walls of a capillary need to be really thin in order for things to move across or in and out of the vessel into the tissue. So a capillary only has endothelium. So I'll put that here. So capillaries. So capillaries only have an endothelium, which is basically one layer of squamous cells. So it doesn't have any fibrous tissue, it doesn't have smooth muscle, it doesn't have elastic tissue, it only has endothelium. So that's it. An arteriole, or the next type of vessel, as far as vessels that bring blood or take blood from the heart out to the tissues, those are arteries. So the next type of artery up from the capillary is going to be an arteriole. So an arteriole is the vessel that is connected to capillary beds. And so arteriole, and it of course has that endothelial layer, so a layer of endothelium. And it has a very small amount of elastic tissue. Like I'm barely even gonna put it in here. It's very small amount. Again, capillaries don't have elastic tissue, don't have anything else. Basically, they only have endothelium. So an arteriole has that endothelium. It has a little bit of elastic tissue. And then it also has a decent amount of smooth muscle. So an arteriole, because it is connected to capillary beds, it has a good amount of control over, blood pressure, how much fluid is, it controls how much fluid is going into and out of a capillary bed. So it controls where the blood is going as far as what tissues are going to. It has the ability to constrict and to dilate. That's why it has so much smooth muscle. So as far as smooth muscle goes, it has a lot. So I'm just going to kind of rank here what it has. So it's got smooth muscle, it has a lot of smooth muscle, and then it has also endothelium. And endothelium is the same. Remember, endothelium is just one layer of cells. So there's the same amount of endothelium makes it up a capillary as is in an arteriole. So the next type of vessel is the largest of the arteries, which is an artery. So again, an artery starts with endothelium, so the endothelial layer. All right, and it's going to be the same as the other two, just one layer of cells. All right, the artery, let me write that down, sorry. So an artery also has elastic tissue, and it has a good amount. And in fact, it has elastic tissue here. It also has a good amount of smooth muscle. A very thick, smooth muscle layer. And then it has elastic tissue around the outside as well. We call that the internal elastic lamina. This one inside is this is the external elastic lamina, and this is the internal elastic lamina. And there also is some elastic tissue within the muscle. So arteries are very elastic. They have a lot of smooth muscle, probably the most, and they have a good amount of elastic tissue. Arterioles have a little bit, just a tiny bit. All right, so those are the arteries. The artery also has, a layer of fibrous tissue. And the fibrous tissue is made from dense irregular connective tissue. It goes on the outside. There. And that, of course, makes up the tunica externa, which is the outside. The other side of a capillary or capillary bed are the veins. So the veins are what take the blood back to the heart to get reoxygenated. So again, we've got that endothelial layer, and this is a venule. So capillaries, once the blood goes through the capillary bed, it comes from an arteriole, goes in through capillaries, does its exchange, and then exits into a venule. So the venule, of course, has the endothelial layer, and it also has a layer of fibrous connective tissue, so this outer layer. Because veins, as you see, are going to have smaller wall thickness, lower wall thickness. So they're going to be more, they're going to look like they're not really together. Like the artery is going to look round and strong and whatever. A venule and a vein is going to look kind of floppy, kind of collapsed looking. So this fibrous connective tissue around the venule kind of helps give it some structure. The venules empty into veins, which of course start with an endothelial layer, and again, same, always the same for every vessel on the endothelial layer. It also has a little bit of elastic tissue around it. Not a lot, not as much as a capillary, or an artery, but it does have some. It should be able to stretch a little bit. And it also has smooth muscle, but its smooth muscle layer is kind of thin. The walls of the vein are pretty thin in comparison to the walls of the artery there. So the smooth muscle, even though it's there, it's not very much. Okay, its tunica, or its fibrous tissue, is kind of a lot. It's kind of a big in comparison, especially to the artery. It's a little more extensive. So it has a lot. Artery has a little of that. So that's basically what the different vessels look like and how they're what they're made up of. So the fibrous tissue, that makes up the tunica externa. It also can be called the tunica adventitia. The smooth muscle layer is called the tunica media. And then the elastic tissue, along with the endothelium, makes up the tunica interna. All right, so we're going to talk next about blood pressure, and it's important to kind of have an idea of what these vessels look like, because these are what are going to control the pressure that makes blood move. So arteries, very muscular, those are going to be moving blood along quickly. The veins can pump a little bit, but remember, veins are basically your blood reservoir. So about 70% of your blood volume just is stored, or just stays in the veins. Remember, veins have those valves which help the blood move along, because it doesn't have an extensive muscular component to it. So it can't move the blood as easily as an artery. So next we're going to talk about how blood moves and blood pressure.